Welcome to the Pacific Research Institute's Next Round podcast. I'm Rowena Itchon, Senior Vice President, and with me is Tim Anaya, Senior Director of Communications.
Well, Ro, just like I was thinking about it over the weekend, I was watching one of the old Batman movies. And you know, the villains, they always think they foil them, and then somehow they always come back. And once again, in California, one of our old villains has come back, and that's the California single-payer bill. But we have our own, well, really, not Batgirl, Supergirl, to help us fight single-payer as our guest today.
That's right. So in this podcast, we have our fearless leader, Sally Pipes. She has to be fearless if she leads a free market think tank here in California. So in addition to running PRI, she's our resident healthcare expert, and she's been following single payer for years, having lived through it growing up in Canada. So Sally's latest book is False Premise, False Promise, The Disastrous Reality of Medicare for All, published by Encounter, and you can get that on Amazon. Welcome back to Next Round, Sally.
Thank you, Ro, and thank you, Tim. You know the old saying, history doesn't repeat itself. It's the same damn thing over and over again. And I have to say, since the late 80s, single payer has been the same damn thing over and over again.
So, Sally, Assemblyman Ash Kalra of San Jose is back with a renewed push to pass Assembly Bill 1400, his single-payer legislation. For our listeners who may not have been following the debate, what is Assemblyman Kalra's proposed Assembly Bill 1400?
So, Ash Kalra, as Rose said, Assembly member from San Jose, is a huge proponent of single-payer healthcare. If you just to go back in time, in 2017, SB Senate Bill 562, a single-payer bill that was estimated to cost $400 billion, over twice the California state budget, was shelved by Democratic Speaker, Mr. Anthony Rendon, because he said it was woefully incomplete, that bill, because there was no funding mechanism. Ash Kalra in 2021 brought in AB 1400, a single-payer bill that would be similar to SB 562. It was shelved in April of 2021 because there was still no funding mechanism. Now, in January of 2022, AB 1400 by Ash Kalra is back. It is similar to the earlier ones. There would be no co-pays for insurance coverage. There would be no deductibles. It would be single payer. The only payer for healthcare in the state would be the government. There'd be no Medi-Cal, no Medicare. It would be the government providing everyone with healthcare. And there would be new added benefits. There would be free dental care, free vision care, free hearing care, and free long-term care. So this is where we are today. It passed the Assembly Policy Committee on January 11th. It now goes to the Assembly Appropriations Committee on January 21st. And then on the 31st, it has to go before the full Assembly. And if it passes the full Assembly, it moves forward. If it doesn't, it will be dead in the water again.
So, Sally, as I was texting with you, the hearing in the Assembly Health Committee was really one of the most interesting and greatest pieces of political theater I think I've watched in a long time. And it's clear that many members of Mr. Kalra's own party share a lot of the frustrations that we and others have with this proposal. One of the criticism, as you noted, of the past effort, and certainly this effort, is about the funding. And the funding part of this bill, as you mentioned, it's in a separate bill. It's ACA 11. And when you look at it, it's all about taxes, taxes, taxes. So could you maybe share with our listeners some of the major tax hikes that will be coming their way if both of these bills, AB 1400 and ACA 11, pass?
Yeah, so ACA 11 is a constitutional amendment in California. It's the Assembly Constitutional Amendment Bill. And it's nothing but, as you say, tax increase for everyone in the state of California. The Cal Tax has estimated that the taxes raised, if ACA 11 were to pass, would total about $163 billion. But as we know, $163 billion to cover a $400 billion a year single payer bill is not enough. So one of the things that the Assembly tried to get through under AB 1400, the earlier version, and SB 562, the Senator Ricardo Lara, who's now the insurance commissioner in California, and Tony Atkins, was that they wanted to get waivers from the Federal Department of Health and Human Services to get the funds that the feds were paying to the state for Medicare, the program for old age Americans, and the Medi-Cal, the program for lower income Californians. So they wanted to get that, but it was impossible under President Trump and HHS under the leadership of Alex Azar. But now with Mr. Javier Becerra being the Secretary of HHS in DC and the former Attorney General in California, and a huge proponent for many years of single payer. I think that if the state passes the assembly bill and it goes forward, I don't think there would be any problem with the state getting those waivers. But the tax increases, 163 billion in new taxes, are coming from a variety of sources. There would be a new 2.3% tax on businesses on the first $2 million in gross receipts. That's not on profits, that's on their gross receipts. There would be a new 1.25% payroll tax on any business with 50 or more employees. Thank heavens, PRI doesn't have 50 or more employees. Then there would be a payroll tax increase on individuals, starting at 1% on any employee earning $49,900 and over. Marginal tax rates would increase significantly to the point where the marginal tax rate on wages in the state would go up to 18.5%. California already has the highest state taxes in the country, and this would just be a disaster as we've seen more and more individuals and companies move out of the state of California because of the tax burden. This would just further push the rush out of the state.
So, Sally, what would the impact of those tax increases be per person? Certainly $163 billion is an astronomical number. What would the per person impact be of that?
Yes, it's very hard for the man in the street to sort of get a grip on $163 billion because it doesn't relate to their family position. But the Tax Foundation has said that this single payer AB 1400, which would double a state's taxes, would cost $12,250 per household increase in a family's tax bill. That is a huge amount of money. It's more than most families are paying for their health care from their employer, where they pay part of the copay, or for what they're paying on the exchange if they don't have subsidized coverage. So it's really a doubling of the state's already high tax collections. And I think people need to realize $12,250 per household tax increase is a significant increase in the tax burden that they face.
Sally, another big issue with ACA 11 is that it would weaken taxpayer protections in the state constitution to generate more revenue to fund deficits in California's government-run healthcare program. How does the bill make it easier to raise taxes in the state?
Well, under the state constitution, any bill that comes forward has to have a 2/3 majority, any bill to do with tax increases or funding issues. So it needs a 2/3 majority, which, I mean, at the moment, with the Democrats having a supermajority in the Assembly and in the Senate, they really do have carte blanche, but a 2/3 majority is more difficult. If this were to pass and it was only a simple majority was needed to pass these tax increases, it would be a lot easier. But as I understand it, this would have to go to the voters of California to approve a constitutional amendment to have a simple majority for tax increases.
One of the things that's been kind of the hallmark of this issue of recent years has been the role of unelected government bureaucrats in kind of setting major healthcare policy changes for the state. We all know, our listeners may remember, Gavin Newsom has this single payer commission that's out there and is supposed to be working on the plan. Unfortunately, the governor forgot to appoint you to the commission. That would have been fun to see you in those meetings. But this bill has another unelected board, a 9-member board that would be set up to administer the program and control costs. So in your view, how would having this unelected board of government bureaucrats overseeing major healthcare policy decisions impact the healthcare that we all rely upon?
Well, just to back up a minute, Tim, I wanted to say that, Governor Newsom, as you said, has been a huge, major supporter of single payer. And in 2017, when he was running for the governorship, which he was elected in 2018, as I mentioned, there's a supermajority of the Democrats in the Assembly and in the Senate. Newsom had tremendous support from the California Nurses Association. It was really the nurses and all of their hard work that helped to get him elected governor. Now it's interesting with AB 1400 and Ash Kalra's bill. Governor Newsom has not said whether he supports Ash Kalra's bill. In fact, he said Kalra hasn't even sent it to him to read it. But, I think part of this has to do with the fact that he is worried about his reelection. He did survive the recall in 2021, but he might have a bit of a tougher road to hoe to become governor if he were to support single payer. Under this bill, yes, you're right, Tim, there would be a 9-member board of advisors. I was not appointed to Healthy California for All. I was not appointed to that commission, and I'm sure I would not be appointed to the special board, the 9-member board. I also want to point out there would be another board, a policy board, which would be made up of public citizens. So it's going to be very difficult to get this bill through the Assembly and then through the Senate, and that because of the tax increases and the fact that I think Newsom is not stepping up to the plate. We can talk later about what Newsom's idea is for expanding Medi-Cal to cover all undocumented immigrants in the state.
So, Sally, Californians who live in rural and even some urban areas are already medically underserved. CalCare threatens to make our shortage of doctors and nurses even worse. So how would it do that? And why would a single payer system discourage people from going into nursing or doctors, from setting up practice in California or becoming specialists?
Yes, as you pointed out, there is a shortage of doctors and in particular specialists and nurses in rural communities in California. If single payer were to become the law of the land, we would see a number of doctors. We already know from the American Association of Medical Colleges, there's going to be a shortage of primary care doctors over the next few years anyway. But if California were to adopt this, we would see a number of doctors quit medicine, or the alternative would be they would move to Arizona, Nevada, Texas, Florida, and it would be like medical tourism, but from the state of California to other states where they could practice their trade in the way that they have been trained to do. So we would see a growing shortage, not only in key urban areas like San Francisco, San Diego, Los Angeles, but it would be even harder felt. It would be felt in a much greater way in the rural communities. Also, the issue that doctors, are paid under the private insurance, they're paid basically what the cost of their service is. But as we know, those doctors who treat Medicare patients and Medi-Cal, which is our version of Medicaid, these docs are paid 35 to 40% below what they get paid for treating patients who have private coverage. So if this became law, docs would be paid a lot less. And we can talk later about the impact on waiting times and ration care and things. But a lot of docs, as I say, would quit medicine because they wouldn't be paid the market rate for their services. So we would have even a further shortage of doctors.
Well, it makes you wonder, will our traffic on the roads to Reno and Las Vegas grow worse? Because wouldn't everybody be trying to go out of state line to see their specialist?
Well, you're absolutely right, Tim. And I can just imagine, people say, well, doctors love their life in California. They love the weather. They love so many things. But at some point, they are going to say, this is not fair, and I'm going to leave the state. It'd be one thing if this were a national single payer bill at the federal level. I mean, the question is, where would doctors go and where would we as patients go? But I think this is really something that the California taxpayers need to realize. They will probably have a harder time getting a doctor, getting a top specialist to treat them, because the top people will leave the state or they will retire early from medicine and do something where they feel they're more productive and they're paid the market wage for their services.
On the issue of waivers, we discussed a little bit about, Javier Becerra is a strong proponent of single payer. Do you think Joe Biden, given that he's been somewhat cool, at least on the campaign trail, to fully embracing single payer? Of course, we know he has his support for the public option. Where do you think he would stand when he tried to prevent Becerra potentially from going forward? And couldn't we see waivers going back and forth if we had a change in administrations to a Republican president in 2024?
The $163 billion in tax increases that are part of this single payer initiative, that is not going to be nearly enough to cover the cost of single payer. As we know, The Senate bill version in 2017 was $400 billion, double the state budget. And the state budget today is $286 billion, and $400 billion would still be a lot to raise. And I think that if the state of California got the waivers from HHS, from Javier Becerra, the Secretary of HHS, waivers to cover so that Medicare and Medi-Cal, or Medicaid, the national name, if those funds were then directed to single payer, it still would not be nearly enough to cover this estimated $400 billion a year boondoggle. President Biden, who came into office in January of 2021, during the campaign where he was toe-to-toe in battle with Senator Bernie Sanders, independent from Vermont, but really the Pied Piper of single-payer healthcare, Joe Biden went out and said he didn't support single-payer. People like their employer-based coverage, which covers about 160 million Americans today, and that he supported the public option, which would be a government insurance plan to compete against private insurers in the marketplace, and in particular in the Affordable Care Act exchange plans. But as we all know, once you get a government insurance plan competing against private insurers, they will price their product cheaper, and ultimately the private insurers will be crowded out of the market. So Biden was very careful in his campaign rhetoric to not support single payer, even though his vice president, as we all know, Kamala Harris, former California AG, she's a huge proponent of single payer, but she kind of got her knickers in a twist, as we should say, in some of the speeches that she did when she was seeking the nomination as well. One day she was for single payer, and she certainly supported Senator Sanders' various single payer bills. But then when she found out people were against her, then she said, I'm not for single payer. But in fact, she is for single payer. And I think President Biden has a lot going on with his sort of on the shelf Build Back Better bill and the infrastructure bill. So I think he would be very hesitant to support single payer at this time. He hasn't even been talking about his public option. A couple of the things in Build Back Better are the fact that, of course, no one would pay more than 8.5% of their income for exchange coverage. So that would be, for insurance coverage. So that really puts more government in control, because a lot of wealthier people, would be able to, get subsidies to cover the cost of their insurance. And the fact that now people earning more than 400% of the federal poverty level will be able to get subsidized exchange coverage. So I think President Biden is in a bit of a difficulty, but I don't think he can support single payer right now. And he even can't support the public option. And the full extent of the Build Back Better legislation didn't even get into the final bill that they're negotiating on right now again, but I don't think it's going to go anywhere, in my opinion.
Sally, in your book, False Premise, False Promise, and in writings and analysis over the years, you've documented in a great deal of detail what you call, quote, the disastrous reality of Medicare for All, the real life stories of people living under single payer systems who have faced the consequences of government healthcare. So if the CalCare plan becomes a reality, paint the picture for Californians. What would they experience as far as the availability of care, the ability to see specialists, or even wait times? How would Californians battling a severe disease like cancer fare under the CalCare system?
Well, as a former Canadian who grew up under single payer and who's written so much on this issue, I really think that we need to educate so many Californians and Americans in general too on the disastrous reality of Medicare for All. Because when government is totally in charge, what will happen is when people think their healthcare is free, they will demand a lot more of it, and it'll be very expensive. In Canada, they spend about 11% of gross domestic product on healthcare. We spend about over 18% of GDP on healthcare. But in Canada, because they only spend 11% of gross domestic product on healthcare, you have these following issues. You have long waits for care. You have care rations so that the elderly get less care. You have the lack of the latest innovation in medical technology, in equipment that we have so readily available here in the United States. And you face a doctor shortage. The other point is that in Canada, you cannot just call up your dermatologist or your OBGYN or your cardiologist. You have to go through a gatekeeper, and it depends what level of doctors your gatekeeper has. But the average waiting time in 2021 in Canada from seeing a primary care doctor to getting treatment by a specialist was the highest on record, 25.6 weeks. That is roughly half of the year. And we have so many stories that I wrote about in my book and in my recent op-eds, how people die on waiting lists because they can't get care. And particularly during the pandemic in Canada, the access to cancer surgeries, cancer diagnoses, and the treatments with chemotherapy and things, it hasn't been available. So I think we're going to see an increase in the death rate, life expectancy of patients in Canada because they haven't had access to the best of care. So we need to remember that when government is in charge, they will determine how much healthcare we can get, what kind of healthcare, and we will have long waiting lists, ration care, doctor shortage, and lack of access to the latest technologies and treatments that we have come to expect in this country because we don't have price controls on pharmaceuticals and on medical devices.
We mentioned it a little earlier. What has been the governor's reaction to the Cholera bill? He is a stated supporter of single-payer health care. Do you think he will ultimately support the bill? And what about this single-payer commission? What role are they playing in the Cholera bill and the move toward a government-run healthcare system in the state?
Governor Newsom has been playing it very close to the chest. I mean, he has not come out and said anything about AB 1400, the Cholera bill. He did say that he, in response to questions about AB 1400, he said, I refer you to the Healthy California Commission for All, which is that commission that set up in late December of 2019. And of course, the pandemic hit in March of 2020. So there were, the whole commission was put on hold. Governor Newsom has said that he is expecting a full report on how single payer would be funded in the state in the commission's report, which is supposed to be released in February of this year. I think that's probably a bit early. I don't think they're going to be able to, the report will not be finished then, but everyone who is on that commission is a supporter of single payer. And I've debated several of those people over the years on single payer, but they're totally committed to it. And, it's going to be interesting to see how the commission responds to the funding mechanism for single payer in this state. But Newsom is playing it close to the chest. And I think I just read recently that the California Nurses Association is furious with him because they say that he has shifted his promise of supporting single payer. And they are the group that very much helped him and other unions to get elected. And just one other point, I think that union members are going to be very negative on single payer because that most unions negotiate with their employer to get terrific employer-based insurance coverage, and they're not going to want to give up and end up having ration care and a doctor shortage and long waits. And we saw that in New York State when their single payer bill was finally shelved last year. It was the unions that helped to put the kibosh on it.
So Governor Newsom released his own healthcare proposal in his budget plan, a plan to add Medi-Cal coverage to all undocumented immigrants between ages 27 and 49. What would the governor's plan do, and how much would it cost taxpayers each year? And how is it, as you argue, a stepping stone to single payer?
Yes, this is Governor Newsom in his budget proposal to add Medi-Cal coverage to all undocumented immigrants. Right now, all undocumented immigrants, except the group 27 to 49, are covered. In one group, the undocumented immigrants 50 and over will become covered under Medi-Cal in May of 2022. But his budget proposal, at a cost of $614 million to set up in the first place and $2.2 billion every year thereafter, will cover an additional 764,000 undocumented immigrants. So this is really putting the government more involved in the healthcare program. And while Newsom is not supporting single payer, this is adding another large group to those who receive government care. And in my mind, it is a stepping stone approach to single payer. And yet he doesn't have to say that during his gubernatorial run, the election will take place on November 8th this fall.
As we close, where do you think things will go from here with the Cholera bill and the effort to enact single payer in California? And do you think voters would ultimately approve CalCare or something similar if it's placed on the ballot?
Well, I personally feel that this AB 1400 and ACA 11 will not move to the governor for final signature. I just don't see. The tax increases are astronomical. And in a recent poll, 2/3 of Californians polled said they did not support single payer. So we'll have to wait till January 31st to see if the Assembly passes it out and over to the Senate. But I think people are aware that many individuals and families and businesses are moving out of the state because of the high tax rates. So I think this is going to have, quite a profound effect on voters and on residents of California. Remember PJ O'Rourke's great saying, if you think healthcare is expensive now, just wait until it's free.
Thanks so much, Sally.
Thank you both.
If you like this episode, please tell your friends and subscribe to PRI's podcast at iTunes, Google Play, Stitcher, TuneIn, iHeartRadio, and Spotify. And when you're on these platforms, don't forget to give us a big 5 stars. If you don't subscribe to any of these, you can still listen on PRI's YouTube page, youtube.com/Pacific Research 1. That's the number 1. Thanks for listening. I'm Rowena Itchon. Hope you'll come back again for next round with PRI.